We are back with the Hemodynamics and Circulatory Shock PowerPoint. We're moving on to video 4, which focuses on cardiogenic shock. And so we're going to look over the same things that we've looked over with the other two. Your signs and symptoms, what your CT and X-ray are going to look like, what you're going to monitor for hemodynamics, what medicines you can give them, ABG, what mechanical ventilation will do for them, specific concerns, and a summary. So physical exam for cardiogenic shock. Your common findings include hypotension, the absence of hypovolemia, decreased urine output, and pulmonary edema. And then your signs and symptoms will include altered mental status, oliguria, low pulse pressure, and crackles in their breath sounds. So then imaging. On the left there, you have your X-ray, and as you can see, your heart silhouette is very large. There's basically no expansion of the left lung whatsoever. The rule of thumb is that your heart shouldn't take up more than half of the left side of your chest. As you can see here, it's barely giving that lung any room to expand. And then you can also see that it is enlarged on this CT scan as well, and that is a common thing you're going to see with cardiogenic shock. So your hemodynamics, there's a little bit more information to this one. Again, you're going to monitor it through a pulmonary artery catheter. Your wedge pressure is going to be increased. Your output is going to be decreased. The wedge pressure, you're going to anticipate it being over 15 millimeters of mercury. And we can suspect mitral regurgitation if there are large V waves on the wedge pressure tracing. We can suspect ventricular septal rupture if there's an increase in the SpO2 between the right atrium and the right ventricle. So, right there in the valve where it goes through, if there's a change in the oxygen saturation. And then we can also suspect right ventricular infarction if there's increased filling pressures, but not an increased wedge pressure. So then pharmacologic treatments, the main one's going to be fluid resuscitation, giving oxygen. If it's a patient with acute coronary syndrome or an MI, you're going to want to give aspirin or heparin. And then if you can also give beta blockers for a patient with a normal BP that is also off of inotropes and vasopressors. If the patient has signs of heart failure or low output, you do not want to give beta blockers. And then you also want to avoid giving renin-angiotensin-aldosterone system antagonists in a hypotensive patient. So for your ABG, we're going to be looking at the same things, looking for acidosis, hypoxemia, and hypercapnia. And again, if it's a mild acidosis, you could consider shock, but it's not going to be a definitive diagnostic test at that point. So then mechanical ventilation for cardiogenic shock. Intubation and mechanical ventilation should be initiated if the patient cannot protect their airway. So again, if they're going into respiratory arrest or failure, you're going to want to consider intubation and mechanical ventilation just to prevent them from getting one more thing that is worsening their condition. And if they have cardiogenic pulmonary edema, then non-invasive ventilation has shown to improve hemodynamics and can prevent them from ending up intubated anyways, mainly just because that pressure can help push that fluid out and back over the membrane so that it's not sitting there in the lungs. And then specific concerns for cardiogenic shock. If you give too much positive pressure ventilation, it can compromise venous return to the heart. And we're going to try high flow oxygen before we try intubation and mechanical ventilation, just because we want to avoid causing any more problems than they're already experiencing because of the shock. And so just to summarize what we've gone over again, we looked at the physical exam symptoms that you're going to see with cardiogenic shock. We looked at the imaging for cardiogenic shock, noted that the heart silhouette is typically going to be very enlarged. We looked at some different things you can expect to see based on hemodynamic values, such as a ventricular septal rupture, mitral regurgitation, and right ventricular infarction. We looked at what pharmacologic treatments you can give for cardiogenic shock, what you expect with your ABG, what you can do in terms of mechanical ventilation, and what you should watch out for with giving positive pressure ventilation.